Hi, my name is Leah Marcelin, and I'm here to talk to you today about pharmacy and the roles and responsibilities of pharmacists. First and foremost, the responsibilities of the pharmacist, I like to say, are the 5 rights of the patient. First, that it's the right patient getting the medication, it's the right drug at the right dose, through the right route, and at the right time. And then for the specific area of pharmacy that I deal with, also at the right price. There's different types of roles that pharmacists can play. The first is the most common that we always all think about is a retail pharmacist. And that's a pharmacist that's in a CVS, a Walgreens, Publix, and so on, that's filling your prescription as you're going shopping. And making sure that the 5 rights of a patient are met and that the drug that's being dispensed to you is the right drug for you and that you know how to take it and any side effects to expect from it. The second is an ambulatory care pharmacist who most likely or in most cases serves as a physician extender of the practice. So a great example is an ambulatory care pharmacist at a diabetes center. They will work with the physician and the practice group to see the patients on a more frequent basis, checking their blood sugars and micromanaging their medications for them, so adjusting their insulin and so on. The next type of pharmacist, that's a common one, is a hospital pharmacist. And they can serve in a bunch of different ways. They can be more operational, and so verifying drugs coming out of the IV room, like a vancomycin, that's going to be given to you intravenously, or they could be rounding on the floors for the interdisciplinary team, working with the physicians and the nurses and so on to make sure that the care you're getting is the best care for you. Then there are other roles, like pharmacists working for pharmaceutical companies. If you like sales and you like to travel, that could be a great route for you as a pharmacist. Or you can be in the drug delivery or drug development. So doing research with teams to develop the next new hot drug that's going to be out there. Then you could be in administration, which is my role. So I'm the Director of Pharmacy Business Affairs for Baptist Health South Florida. And I work with all of the non-clinical types of things in pharmacy. And so part of my job is to serve as the bridge between pharmacy and finance, and so I help develop the drug budgets and explain why costs may go up because this new drug costs a lot of money. Or I do regulatory things, so I work with the government programs like the 340B program to make sure we're being compliant. I do a lot of audits, help find ways to save both the health system and patients' money. A great example is I'm in charge of patient assistance programs, and so I help look for patients, qualifying patients to get free drugs. And so we often see a lot of cancer patients and are able to sign them up for programs to get their care for free, so it helps them overall. Please reach out to Shayna if you have any interest in learning anything else about pharmacy.